recording so that I will start questions.
Started.
So, sir, before we end, we have some questions. So I will ask one by one. So first question is from Dr. Rashmi Biradar. She is asking that how long can we give 500 OD to a woman?
Yeah, so our guidelines recommended you can give safely for 3 to 6 months and then you reassess and reevaluate. Obviously, people do give up to 1 year also, but 6 months is our recommendation. Then you have to reassess and this thing. So 6 months and then you can stop and review.
Okay, sir. Second question is from Dr. Madhurika. She is asking any pre-evaluation needed before starting oral tranexamic acid, and is there any monitoring needed before starting?
Yeah, so as I clearly told you that you have to take the history, 10 questions and ask it. There is no special testing required before the thing, but history is very important. And when the patient is on treatment, again, you don't need to do any repeated blood check or anything to find it out. Typically, the dose is low, so history is important. That's all. No investigations.
Okay, sir. She's having another question. What is the maximum duration tranexamic acid can be given? Oral tranexamic acid.
Yeah, so recommendations for 6 months, but I know people give it up to 1 year also. It is known to their thing because as such, what we are giving is a low dose. But the decision depends on the treating dermatologist. He has to assess and review. Our recommendation is up to 6 months.
Thank you, sir. So third question is from Dr. Harshini. She is asking tranexamic acid can be given to patient with past history of COVID positive.
Yeah, see, those who have got COVID, they can take this thing, but obviously they should not have any thromboembolic episode post-COVID. Whereas post-COVID, there are some results. So if there is a normal COVID which had recovered, patient's parameters, patient is healthy and this thing you can give. But obviously a thromboembolic episode is a contraindication.
Okay, thank you, sir. Fourth question is from Dr. Madhuri. She is asking, you mentioned that we can continue it for 6 months. Do we have to taper the dose while stopping? Another question with that is, how often have you encountered recurrence, sir? And she is thanking you for the session.
Yeah, so see, typically after 6 months, if you're seeing results, you can make it up to 250 mg once a day for a few months and then stop. But our recommendation is only up to 6 months. Obviously, recurrence is the rule. Obviously, if patient doesn't take precautions, so after stopping 6 months of therapy, patient need to continue sunscreen and topical creams and maintain the results. But obviously, they might get recurrence. Then you need to restart the treatment, again considering all those contraindications.
Sir, another question was, do we need to taper the dose as well?
Yeah, so taper is, our recommendation is not there, but my personal opinion, sometimes I do is 500 mg for 3 to 6 months and 250 mg for another 2 to 3 months and then stop. But it's not in the recommendation.
Okay, thank you, sir. Dr. Deepak is asking, please repeat the usage of tranexamic acid along with triple drug combination.
So as I told you, one of the best treatment as on today is oral tranexamic acid and a topical triple combination, which is to be used with a sandwich therapy with the cleanser and a moisturizer, and followed by a night cream of say vitamin C kojic acid. So this is the best combination as on today for the treatment of melasma. So you can give broad spectrum sunscreen in the morning 2 to 3 times a day, night time triple combination for 2 to 4 hours. After 2 to 3 months, you can reduce the frequency to alternate day triple combination, and then twice a week for 2 to 3 months. You can go up to 1 year. Tranexamic acid, obviously, after 3 to 6 months, you need to stop, but you can take a chance because people have given it up to 1 year also. So that is a treatment which I feel is one of the treatment which gives you a satisfactory results.
Okay, thank you, sir. Next question is from Dr. Benazir. She is asking, kindly again mention the guidelines of triple combination, how to taper it down.
Yeah, now this is again given in the various publications. It is not my thing. So even our guidelines say that. So typically you have to start in the night time, apply on the affected area and wash after 2 to 4 hours and use a moisturizer. First 2 to 3 months, you will say results, then you can make it alternate day or twice a week for another 3 to 6 months. And then again, continue. You can safely do that twice a week for another 6 months to 1 year. There are studies that up to 1 year, you can use triple combination without fear of side effects or atrophy. But the judicious use is important, and typically the results can be maintained by using a twice a week therapy for this thing. And overnight application of triple combination is not tolerated by most of the patients. So 2 to 4 hours up to 6 hours is what we tell the patient to use it, followed by a moisturizer or vitamin C cream.
Okay, thank you so much, sir. Next question is from Dr. Ganesh. He is asking, what about the maintenance after 6 months? So he must be asking how to maintain the patient after 6 months.
Yeah. So once you get the results, then you have to maintain with topicals. That is the best way. So topicals you need to continue and reduce the triple combination gradually. This thing. So the guidelines say that 3 to 6 months is what we recommend. Sometimes a lower dose of 250 mg once a day for another few months may be required to maintain the effects. But that whole decision depends on you and your patients to use it. But yeah, maintenance is an art because recurrence is the rule in most of the melasma patients.
Okay. Dr. Jaya and Dr. Poonam has the same question. Can we use tranexamic acid with glutathione?
Yeah, now remember the results what you get with tranexamic acid cannot be compared with glutathione orally. So I will not advise you to use both together, but tranexamic acid itself is one which shows great results. So I will advise you that not to combine both the therapies. Use it separately if at all, but glutathione results are not as great as of tranexamic acid.
Okay. Next question is from Dr. Manjunath TS. He is asking any interaction with drugs commonly used.
Yeah, so typically drug-drug interaction are not many. Obviously, if patient's kidney is compromised with creatinine more than 1.4, or his liver is damaged, or his liver is not functioning properly with high enzymes, then you should avoid giving this medicine to these patients. Otherwise, no major drug-drug interaction.
Okay. Dr. Prashant has the same question. Can you repeat how to taper the triple combination? I guess we have taken that question.
Yes.
From Dr. Roshni, sorry. She's asking, what are the contraindication for starting tranexamic acid?
So I repeat, contraindication is those who are on OC pills, heavy alcohol, heavy smokers, damaged liver, damaged kidney, creatinine more than 1.4, thromboembolic episode in the family or in the patient, spontaneous abortion history, visual disturbances. All these points to the something is wrong in his vascular system. So there you have to strictly say no for the patient. So these 10 questions which you have posted are the one you ask the patient, and if you are convinced that patient has got healthy liver, healthy kidney, and is taken, you can give them. But these 10 questions are important.
Thank you, sir. Dr. Aruma Ghani is he's asking why we should not combine tranexamic acid with chemical pills, sir. Rest, he is thankful for the wonderful session you have taken.
See, what I say that you can use chemical pills, superficial chemical pills with tranexamic acid. And the thing, what my mention was the depigmenting therapies or the potent strong pills. If you want to do, don't combine with this thing. But having said that, there are people before CO2 fraction laser or before where you expect a post-inflammatory hyperpigmentation, you can use tranexamic acid. But our suggestion is you can use chemical pills with tranexamic acid, but if you're using triple combination with tranexamic acid, use with caution chemical pills, and only superficial chemical pills are allowed and not the medium and deep pills are allowed.
Okay, thank you so much, sir. Next question is from Dr. Pratiksha. She's asking any benefit of topical tranexamic acid.
Yeah, so we already reviewed this product. There are many products available with 2 to 5% creams and gels available. The results are conflicting, results are not great, and what you need is a good formulation, lipid-based formulation or a gel-based which can penetrate. So as on today in Indian market, we don't see such big good molecule. There are studies from US where they have shown results. So there is no recommendation from our side to use a topical tranexamic acid. Injectable, yes, there are some studies which does show effect, but obviously you need to give it more often, and how much is the concentration? Again, bigger studies are needed before a convincing answer to this question can be given.
Thank you, sir. Next question is from the Dr. Jaspreet. He's asking how much gap must be there before starting tranexamic acid again in relapse cases.
Yeah, so typically 3 to 6 months you are given, maybe another 3 to 6 months you can keep a gap, and then you can restart it if there is a relapse. But again, we are not able to give a recommendation because of lack of studies. But again, you can give it another for 3 months and 6 months and check. But typically, a gap is needed between the two regimes.
Okay, thank you, sir. Next is from Dr. Shashikant. He's asking, is D-dimer test is needed to monitor tranexamic acid therapy?
No, so D-dimer test, PT time, or these are not needed when you are giving a dose of 500 mg per day, and it is not. But somebody having a thromboembolic disorders or anything, there we use this kind of test to assess the coagulation factor. But the routine, what we are giving 500 mg, routine investigations are not recommended.
Thank you, sir. Dr. Rashmi again has the same question. How effective is topical tranexamic acid? We will already had discussed that. Next is from Dr. Priyanka. She's asking, should we consider it as a first-line therapy?
Now that just depends on you. As on today, we have find a very good review to tell you that it works. It works definitely in more than 60 to 80% of the patients. So it may be considered as a first-line therapy, provided there are no contraindications.
Thank you, sir. Next question is from Dr. Nidhi. She's asking, please share your experience of oral tranexamic acid in lichen planus.
So for lichen planus, well, I will not use oral tranexamic acid. For lichen planus, the preferred therapy should be steroids or cyclosporine or methotrexate. These are the options, but I don't see utility of tranexamic acid in lichen planus pigmentosus or lichen planus, where the pigment is very deep, and there are no studies of tranexamic acid in lichen planus to best of my knowledge. So I will not advise to go ahead with this.
Okay, thank you, sir. Dr. Madhulika is asking, in women with menstrual irregularities, is there any contraindication for using oral tranexamic acid?
Menstrual irregularities could be due to other reasons. So I don't see any contraindication. In fact, those who have got menorrhagia and all, they do see the results that hypomenorrhea occurs, so the bleeding comes down. Unless they have got major hormonal problems or they are on some other hormonal pills, then you cannot give tranexamic acid. Otherwise, you can give.
Okay. Dr. Aruma Ghani is asking again that I am using triple combination overnight. It is very effective, sir. Kindly enlighten us.
Yeah. So see, few of your patients can tolerate triple combination effectively for overnight, say 6 to 8 hours. But what I told you is to begin with, most of the patients do find it irritation and this thing. So we start with 2 to 4 hours and extend up to 6 hours, and then you can keep it overnight. So gradually titration is required. Otherwise, half the patient will come back to you with irritation, redness, burning, or they might change the doctor. So that's why overnight application, I don't advise routinely to patients. You gradually build up, and then maybe after a few weeks, 4 to 6 weeks, patient can keep it overnight.
Thank you, sir. We have Dr. Ritu as well. She's asking, does it work for dermal melasma?
Well, the studies are there which show that it does effect. It has shown effect in dermal melasma also. Histopathology also has shown the results, but not major big studies to give the convincing answer. But it works in most of the melasma.
Okay, thank you, sir. Rest, there are two more questions which we have already taken. One is from Dr. Harshini. She's asking, again, that can we use it with patient with the history of COVID positive? We have taken that question. Last question is from Dr. Arshad Nidim. He is asking, is it safe to use oral tranexamic acid for the treatment of melasma in male patient? We have also discussed that before.
Yes.
So, sir, we have completed almost all the questions. We have total of 39 questions in this session. And I would like to thank everyone who have taken part in this session, especially Dr. Kiran Gutse, sir, who has taken his time and addressed all the questions. So thank you so much, sir. Thank you all the doctors who have visited and attended this session. We hope this session would have enlightened all of us, and we would like to bring more sessions like this in the upcoming days. We at Acumentis are committed towards the scientific initiatives. Thank you, everyone. With that, I would like to close this session. Sir, can we close the session now?
Thank you. Bye-bye.
Thank you so much, sir. Thank you.